we want to empower the patient. I think that's really the most important thing, is that lifestyle recommendations have to be done right. If we just throw it at patients saying, make this change, sleep and eat and exercise, it's really overwhelming, and it tends to make patients feel like they're doing something wrong. And if only they were able to fix this, then everything would be okay. It's really not that simple. Like, lifestyle management is one tool in the toolbox, and it's not everything. Sure, like engaging in like healthy behaviors can reduce migraine severity and frequency in some people, not in everyone, but it's not the holy grail, and it's not something that patients should be blamed if they can't do it. We really need to work with patients to empower them to make these changes. So in terms of recommendations, in 2020, the American Academy of Neurology updated its headache quality measurement set, which said that providers should now counsel migraine patients on lifestyle and behavioral modifications at every visit. So we do have recommendations that it should be done, but there's no guideline on how to do it. I think that's really the biggest point, is that every single doctor is going to do it differently. And we don't get training for this in medical school. Like, no one really sits down and says, how do you talk about lifestyle? So it's something that's curated by each doctor differently over time. In headache medicine, it is something that we do talk about a lot because it is important. But I think the way we communicate that to patients really is the most important takeaway point, telling them that it's part of an integrated treatment plan. It might not work for everyone, and it is not the cause of migraine. So telling patients that you are not causing your pain, it is not your fault, really is important, because there's so much stigma surrounding it. And we really just need to use this as a way to empower and not to blame. So patients who feel powerless to make changes, acknowledging it's okay, and then providing specific instructions. So instead of saying, go out and do exercise. Well, okay, well, how about you do 5 minutes of walking to get your heart rate elevated above 100 beats per minute. Do that twice a week. And then next week, if you're doing okay, maybe do that for a little bit longer. And then having really frequent follow-up to track progress, because patients really want to know that we are listening and that we're involved in their care and that what they're doing is being recognized.